Hello, this is Dr. Chudi, and today we will talk about another important topic. In women's health, we'll talk about the process of forced labor, the phenomenon we call Braxton Hicks. So today we'll talk about Braxton Hicks. You can just call it forced labor to a layman. So this is actually a fairly common event that can happen in some pregnant women. It normally presents as a mild, painful tightening in the belly. It comes and goes, so you have to take note of this because some people can mistake this for real labor. Braxton Hicks is false labor, so it comes with tightening of the belly. And some women would describe it like contractions that come like your normal menstrual cramps. But please, Braxton Hicks can be uncomfortable, but it doesn't mean you've gone into labor, and it doesn't mean it's going to lead to changes in your cervix. Remember, when you start seeing changes in the cervix, then the baby is about coming. When labor sets in, the cervix will change and start softening, start dilating, start shortening in length. When all those things happen, then the process of giving birth to the baby will occur. But the contractions we see in forced labor actually come about the second trimester. But it can also happen in third trimester. When this happens, the muscles of the womb will become so tight and rigid for approximately about 30 to 60 seconds. So you can distinguish this from what happens in labor. In labor, you have sustained very painful, pressure on, your whole pelvic area. But this particular one is mainly a tightening that will last for about 30 to 60 seconds. And sometimes it can last up to a minute, but it quickly goes once it's formed. Okay, so it's very important the difference between real contractions that, comes before labor and Braxton Hicks. Okay, because Braxton Hicks sometimes might be a prelude to real labor. So in summary, there are a couple of things you have to take note of in Braxton Hicks. The first thing to note is that it's irregular in intensity. It doesn't have a pattern. Whereas in labor has a definitive pattern. So if you notice, we'll normally check, how many cm the woman is dilated. But in Braxton Hicks, it can just come in 30 seconds, 60 seconds, sometimes up to a minute, and it goes off. It's infrequent. That means it waxes and wanes as against labor that can be sustained. It's also unpredictable. It's not rhythmic. So it can be more like an uncomfortable feeling, like, very painful, but some women can actually have a very painful experience with this. It doesn't increase in intensity or in frequency, and over time, it disappears on its own. So what are the likely things that can lead to this Braxton Hicks? What are the likely things you should take note of that might be the cause of this particular phenomenon? Well, the truth about the whole thing is no one knows exactly what leads to this. No one can say categorically that this is what happens that leads to Braxton Hicks. But there are some possible causes of the contractions. Some school of thought believe it's just a natural process of the womb in preparation for the real birth, whereas some other believes it has to do with, blood supply to the placenta. But whatever happens, just know that Braxton Hicks, it's not the real labor. During real labor, your cervix will change and a whole lot of things will happen in the cervix, but this doesn't happen in Braxton Hicks. Okay, so the risk factors might be, a very active mother. If you move freely, if you're engaged in, a lot of activities, can lead to this. Also, when the mother's belly is touched, some women, when their belly is touched, it can elicit Braxton Hicks. Also, when you have fluid bladder, when your bladder is full, you don't empty your bowels, this can elicit Braxton Hicks. And in some women, shortly after having sex, it can happen. Also, in some women, if they are dehydrated, it can happen. So how do you manage Braxton Hicks? What are you supposed to do if you have this false labor? The first thing to do that can give you relief is to change position. When you change position, it helps a whole lot. So if you're lying down and you're experiencing this, try standing up. If you're sitting down when it happens, try standing up. So whichever position you were when you started experiencing it, try and alternate that position with doing the opposite. Take a warm bath. This should be like a 30 minutes or less, warm bath. Sometimes if you do this, it works like magic. It gives you some relief. Avoid staying dehydrated. Ordinarily in pregnancy, you're not supposed to be dehydrated. So if you happen to have Braxton Hicks, please take a lot of fluids. Stay well hydrated. Drink a couple of glasses of water or any other allowable fluids. Remember, whatever you take in your body can affect your baby, so be mindful of what you take in your body during pregnancy. And when you've done the above and the discomfort of the contraction persists, this is the point you need to contact your provider. Okay? This is the point you need to contact your provider. And it's always good to present to your provider anyway, because some people can have actual labor. If miscarriage is about happening and you have backache, you have, spotting or bleeding, or you feel like something is gushing out of your pelvic, you need to call your doctor immediately, because something might happen that we don't want it to happen. But whatever happens, just know that forced labor, it's actually, as the name is, it's false. It's not real labor. And it can happen in some women. Okay? Thank you so much for listening. Until I talk to you again. Bye-bye.